Hi, good people. Welcome back to GTV. This is the Afya Law program. My name is Caroline Bine. Thank you for the support. Thank you for everything that you're doing to make sure that kila siku tuko hapa tukikuletea content fresh motomoto. So now, please make sure that you follow us on our pages. That is Facebook hapa. Make sure that you not follow and like the page. Instagram, enda utafute tu GTV, utatupata hapo. Kindly follow. YouTube, kindly subscribe. Huko utapata, in case you miss any program, utaipata either hapa kwa the page ya Facebook ama uende YouTube utaipata hapo. So now today in the program, I am blessed and privileged to have Nasroda back. So kindly introduce yourself to our viewers.
Hello viewers, good morning. I'm happy to be in GTV again for the program of Afya Leo. I would like to welcome all of you. Let us work together so that we may capture the topic, we may capture everything, and we'll go on well. Thank you.
Okay, so we have talked about HIV previously, but we were sana tulikuwa tunaongea kuhusu the expectant mothers. So now we are going to talk about HIV in general bila kuside na watu wote. So kindly tukumbushe, what is HIV and AIDS?
Okay, thank you so much. Last time we were here, we did HIV in pregnant women and children, that is PMTCT. Today I'm privileged to be here again. We are going to do same matters of HIV, but generally HIV and ARV. So first of all, I would like to introduce the topic by saying HIV is an infection. It's a viral infection. The term HIV or the initials HIV means human immunodeficiency virus. This is a virus that works retrogressively by causing low immunity or suppressing immunity in a human being. And it has factors that it has the way that it works in the body. It works with the body cells. It works through the blood systems. It works to suppress immunity through killing blood cells that act as defense in the body system. So it is a viral infection generally that causes AIDS. Yeah.
Okay, and after umediagnose mtu ako HIV positive, how do you handle such people? Because there are people who are in denial first wakati wamepatikana they are HIV positive. How do you handle such cases?
Okay, it's HIV positive. It has not been a very good history. It has not been a very good story, and sometimes people may not know that they have HIV. But when someone is diagnosed, or rather the first steps of during the first steps of testing HIV, there are basic principles that we use. Principle number one is pre-test counseling. What that means is when you are testing someone for HIV, you must give counseling first, because you must prepare this person for the results. Most people come for testing when they are not sick. Others come when they are sick from other illnesses, and therefore these are people who are not ready to receive a result for HIV. And then so we need to do a counseling which is called pre-test. So this is preparation for the results, and therefore when someone has been taken through counseling, pre-test, they are able to absorb their results, even those who turn positive. Now, once we test someone and becomes positive, there is there's counseling in between the testing, there is counseling after the testing. So for this positive person, they benefit from post-tests so much, because once they are diagnosed with HIV, there is some counseling we do on how this person will work with this viral infection. And therefore, now you have asked me what I usually do
Mm.
when someone turns positive for HIV. The first thing I do is post-test counseling.
Mm.
This is a counseling that will help the person to accept that they have HIV, because once someone is diagnosed with HIV, there is a lot of denial, there is a lot of non-acceptance, there is a lot of trauma. Some of them even go into depression. So there is a big package of counseling that we will give to this person so that they will be able to accept the results and also live with the disease or the virus, and also avoid stigma, because it is also a virus that is associated with stigma. So what we usually do first is counseling. Then from there, we now start the person on the ART. ART is a combination of factors, that is ARVs, that is the drugs, counseling, which is continuous, and also other interventions. So we put the person on ART, that is the management for HIV, which is a combined package. Yeah.
Okay, and you've said that some people come for the test when they are sick, others when they are not sick.
Yeah.
So those who come when they are sick, what are the signs and symptoms?
Okay, what I meant by saying they come when they are sick, it's they come to the hospital as a routine because of other sicknesses, but they are not aware that they are infected with HIV. So during the process of treatment for other diseases or investigations, now the HIV test is it's incorporated in the test. So you know, when this person will turn positive for HIV, they did not come because of HIV. So they came because of maybe malaria, typhoid, pneumonia. So in that process, they undergo a test and they may turn positive. That is what I mean.
Okay, and
Yeah.
what are the general signs and symptoms of HIV?
HIV, it has stages, and the signs and symptoms are classified according to the stages. There is stage 1, which is non-symptomatic. There is stage 2, which goes with some signs and symptoms like skin diseases, regular flu, regular RTI. RTI is respiratory tract infection. Then, but that does not mean the person has HIV, but these are associated to stages. Then there is stage 3, which is associated with TB. People present with TB. There is stage 4, where someone will present with the major infections like meningitis, severe diarrhea, toxoplasm, and so on and so forth. So HIV is classified in stages. Yeah.
Okay, and you've talked about HIV management.
Yes.
HIV management and treatment, tuweke hivyo.
Yes.
So I believe kwa kila stage, see what awatumie the ARVs the same, that is.
Okay.
So what are the types of ARV, and for how long are they taken?
Okay. The principle of management, I said it's a package, which is ART, ARVs, that is drugs, counseling, and other packages like laboratory investigations, follow-up, and so on and so forth. So for the person who tests HIV, it is called test and treat. Testing positive means treatment starting. So what I mean is, once we diagnose or we test someone with HIV and they have gone through counseling and they have accepted, they are ready to take the management or the drugs, now we start off the drugs immediately, because we want to counteract with the effect of the virus as early as possible. So about the drugs, the ARVs, there are various types of ARVs. So depending on The person who is 30, maybe it's a child, it's a pregnant woman, it's an adolescent. So depending on who the person is, or the age category, or the population, because there is the general population, there is the special population, there is the at risk, the most at risk. We classify or we give drugs according to the person who has been diagnosed. Yes.
So it's not according to stages.
It is not according to stages, because even though you are in stage 1, you are feeling well, you are looking okay, you came because you wanted just a test, now you test them positive, you start treatment. The person who comes very sick, they start treatment. At the same time, the same category of drugs.
And is there a period that someone is supposed to take ARVs?
ARVs, for now, they are going. People are taking for life. We say they are for life because researches have been going on to establish treatment for HIV, or to the treatment that will end, or rather a vaccination that will prevent. But at the moment, HIV, unfortunately, they are taken for life. So even when you are doing counseling, you counsel the person to know that they'll walk their life with ARVs. So they do not have a duration that they will stop.
Okay.
Yeah.
Just like any other drug, sababu tukipewa drugs tunaambiwangwa there are side effects that may come with wewe kunywa hizi dawa. What are the side effects of ARVs?
ARVs, just like any other drugs, they have side effects. Most of the common side effects which come with ARVs, especially for the people who are starting, things like mild rash, skin rash. Some people may experience vomiting, depending on which drug they are taking, because the ARVs are a combination. We treat with a combination of drugs. So if a combination, a drug has 3 types of drug combination, maybe there is a drug which can react in one way or the other. So once we introduce the drugs and we tell the client or the person to note the side effects, so some may present with vomiting, others with nausea, others with the headache, others with the dizziness, the others will sleep during the day. So there are various side effects, but most of them are mild and normal. They can be controlled, they can be handled, and time by time they come, they finish by themselves.
Okay.
Yeah.
And there's this PrEP.
Yeah.
So how does PrEP work?
PrEP, that is prevention therapy. PrEP works, it prevents someone who is at risk. So, for example, I'll give an example. Someone who has a partner who is HIV positive, and he or she is not positive. Now, this partner who is positive may be taking ARVs, or may not. For them who are taking ARVs, maybe the viral suppression has not gone down, so there is a high chance of transmitting to the other person. Now, this other person who is negative is the person that we are going to give PrEP, so that they will be prevented from getting infected. There can also be someone who is not taking drugs. Of course, we will risk the immunity of the person who is negative, so we put them on prevention. We still consider a population like the commercial sex workers. They are always exposed, and they do transitional sex, so they are at risk, so they can also benefit from PrEP. It's a therapy that puts someone in a preventive period.
Okay, and does it work 100% to every patient that you have attended to?
Yeah, for the patient that I've attended to, it has worked. Yeah.
Okay.
Yes.
So
basically, we have many ARV types. We have types for children, especially like these ones. They are meant for children who are below 15 years, from 0 to 15 years. They sometimes come in formulation of syrups or even in tablets. We have drugs like these ones. These ones they are for adults. They have one tablet has a combination of 3 drugs, so they are well formulated also. Then we have some like there is first line treatment, which is combined of drugs like these ones. They belong to the first line treatment. We have drugs which belong to the second line treatment, and we have other drugs which are called opportunistic infection preventive drugs.
Okay, first, what do you mean by first line treatment and second?
First line treatment is the first treatment that someone receives. A naive patient. Naive is someone who has not used before.
Okay.
So when they are put on first line, the first category. So if there happens along the way, there is resistance or failure of a drug, now we move from first line to second line, depending on the investigations and the follow-up.
Okay.
So now there are first line drugs, second line drugs. There are drugs which prevent other infections. They are called preventive therapy drugs. Like this one. This is not an ARV. It is just a common drug which has been researched and found that it can prevent other infections in a person who has HIV.
So it's a combination. You're given this and this.
Yeah.
Okay.
Yes.
Okay.
So this one is usually part of the package. Then we have drugs for adolescents, like these ones. So basically, when you diagnose, you put someone on the category. So they are categorized. We have drugs for these ones, like this one is for skin infection and other viral infections. It is also used to treat other viruses. You know, someone who has HIV can also contract other viruses.
Yes.
So, I told you the other day about the hepatitis virus, about there are many flus actually. Even the COVID is a virus. So we have other treatment that we combine with ARVs, but when there is need, not always.
Okay.
But then there is this other one. This one is also a preventive drug which prevents TB. TB is a common infection that attacks people whose immunities are compromised. So we have like this one is called rifampicin, rifapentine, and zonazid. Those are big terminologies, but they are used for prevention. Yeah. So
and this one that looks like a syrup.
then this one is used for PrEP. You asked about PrEP.
Yes, yes.
So this one we can use for PrEP, so that we prevent. But it is also an ARV. But according to its combination, it is good for prevention.
Okay.
Yeah.
Okay.
Good.
And there is this cushion. Looks like.
There is this one. This one is also for second line. It is a drug we use mostly for second line.
Okay.
Yeah.
Okay.
Yes, and many others which are not here, of course.
Okay.
Yeah.
So thank you so much for coming through for this. You may have a piece of advice to our viewers.
All right. Thank you very much. It is not all. HIV is a large topic. It's a topic that you can teach the whole week, but basically you cannot miss something you have grasped from this. I would like to encourage my viewers. Maybe you are there, you have been tested, you turned positive, you still don't accept, you have not started your ARVs. I want to assure you that once you start your ARVs, you'll be well protected, your immunity will come back to normal, you may not infect others, and you will be safe because ARVs protect immunosuppression. So thank you very much. I encourage people to go for HIV test. Stigma is a burden in HIV, but it can reduce once we communicate. Thank you very much. Have a good day.
Thank you so much for coming through. That has been our time. My name is Caroline Bide. See you next time.